let's jump into the details of diagnosis. Patients with unintentional weight loss are investigated carefully. There is a diagnostic challenge in most of the patients because there is a broad range of etiological possibilities. We need a careful judgment in initial workup, and in case if further investigations are required, more advanced diagnostic modalities are chosen. Practitioners usually prefer to begin with a simple and non-invasive test. And if they're not sufficient, additional invasive tests are pursued. General practices has following steps. The first one is detailed medical history. Second is physical examination. Third is lab testing. Fourth is imaging. These four are baseline evaluations. And the fifth option is endoscopy. So let's begin with the medical history. First of all, try to quantify the weight loss. If there is no previous weight record by patient, ask about trouser fit or belt tightening. Ask the patient about appetite. Inquire about gastrointestinal symptoms such as change in bowel habit, nausea, vomiting, and rectal bleeding. Investigate about fever, headache. Look for any kind of muscle weakness. Check out symptoms of depression. Ask about smoking and alcohol abuse, because smoking increases the risk of lungs neoplasm as well as Crohn's disease, which is chronic inflammatory disease of digestive tract. Alcohol abuse is also linked with the weight loss. Further, ask about the family history of cancer. Collect some sexual history to find out risk for HIV or human immunodeficiency virus. Take travel history. Check out endocrine symptoms such as thyrotoxicosis, which is excess of thyroid hormone in body. Ask about perception of weight loss and body image to rule out anorexia. After taking medical history, second step is physical examination. For this purpose, body examination should be focused on abdominal mass, organomegaly, which is increased size of organ, lymphadenopathy, which refers to lymph nodes that are abnormal in size, that is more than 1 centimeter, breast mass, signs of wasting, and mouth examination. Mouth examination is done in elders to exclude chewing and swallowing interference due to dental problem, dry mouth, or other lesions. Now, let's have a look over lab testing to find the clues about why body is losing weight. Baseline investigations are complete blood count, liver function test, kidney function test, thyroid function test, lactate dehydrogenase levels, fecal occult blood test, C-reactive proteins, electrolytes, iron studies, albumin, urinalysis, and serum glucose. Choice of diagnostic tool will depend upon the condition of patient. Now we will be discussing imaging techniques. Here, chest radiography and abdominal ultrasonography are baseline investigations. Contrast computer tomography will be appropriate for detailed investigations of chest, abdomen, and pelvic regions. The benefit of computer tomography is better imaging of chest, mediastinum, lymphadenopathy, abdomen, and pelvis, including body organs such as pancreas. Effectiveness of treatment is based on accuracy of diagnosing the cause. Now let's dig in about endoscopy. Endoscopy is basically a procedure where organs inside a body are looked at using an instrument called endoscope, which is a long, thin, flexible tube that has a light and camera at one end. Images of inside body are shown on a screen. 20 to 30% causes of unintentional weight loss are due to gastrointestinal disorders. Endoscopic evaluation in this case is very controversial. One school of thought says it is part of initial workup of all unintentional weight loss patients, while others argue that it should be reserved for cases who initially report gastrointestinal symptoms. There are two criteria for referring patients to endoscopy. First is patients who have gastrointestinal symptoms along with excessive weight loss. And secondly, patients with normal baseline evaluation. In the next part, you will explore about treatment tactics. So, stay tuned and keep watching sqadia.com.